A very good evening to everybody in the philosophy session. We are discussing regarding the Stuart Close philosophy and the chapter number 9, that is cure and recovery. To introduce the chapter, he started with the first point, that is the recall of the medical profession. He explained that during his time, the medical profession was not at all scientific. Everyone was coming out with their own ideas and they considered that is the only treatment, that's all. That was the only method prevalent. Hahnemann started a new era of scientific prescription, scientific homeopathy or scientific medical system. He was the first one to classify the diseases. Then he was the first one to find it out the causes of chronic diseases. He was the first one to develop the cardinal principles to treat the patient. See, this is absolutely a new ideal for the Hahnemann. It was everything was new for the Hahnemann, and he was the first person who started thinking in that direction that medical profession, at least medical profession, should have a principles. And then he came out with the 7 cardinal principles. The latter Hering was there who has added one more principle, Hering's law of direction of cure. And all the laws, all the cardinal principles, they were based upon the nature. They goes hand in hand with the nature. Then he started explaining that scientificity is there, but it is not only sufficient. What is needed is also an art. And then he explained what is the difference between science and art. When you go on following the science for longer time of duration, experienced it, practiced it, and art automatically comes. This is most important thing. If you are able to develop an art, then you are a very good, fantastic prescriber. Then you achieve what you desired. Then you can treat difficult cases with the help of homeopathic medicine. And what is that art? That art is nothing but the application of the cardinal principles to the patient, suffering mankind. To understand the patient and to apply the medicine in both ways, you require the art. And that art, how you have to develop. And that's why he explained the art defined, and he explained homeopathy is a scientific system of medicine, and which is also artistic method of prescribing. Then he compared art is not an imitation of the nature, and that's what we discussed. And it is truth that just imitating someone is not an art. Art comes through your intellect. Art comes through your own thoughts. Art comes you through your own intelligence. It is the result of it with which it approaches. And then you are able to understand what is required for the patient. So this is too important to understand. We have to understand the difference between what is cure and recovery, the discrimination. And he starts over there, the distinction between cure and recovery on the page number 125. Today we're going to start with this part of the book. Distinction between the cure and recovery. The favorable outcome of medical treatment may be either a cure or recovery. To realize ideal of the cure, it is necessary to know the exact meaning of these terms and to be able to discriminate between them. So this is what Hahnemann says, and this is what the Close says. That what if you want to treat really a patient, you must understand what you have to achieve, whether you want to achieve just a recovery or just a cure. Failure to discriminate between cure and recovery endangers. Failure to discriminate between cure and recovery engenders confusion of thought, and leads to pernicious practices. The terms are not synonymous. Natural recoveries following treatment consisting of mere palliation of the symptoms should not be mistaken for the cure, nor falsely paraded as such. In either case, a false standard is set up, injustice is done to the ideal of cure, and scientific progress is retarded. Very important entity which he is explaining over there. When you think about the recovery, recovery happens to be there even without the treatment. But recovery is not restoration to the health. Recovery means just removing the symptoms, or it is just a palliation. Recovery is there where patient feels better after some time. His symptoms disappear, but he has not achieved a state which was prior to it, that is the state of health. That is recovery. Recovery might be possible without treatment, or it might be with the treatment. But that is not an ideal cure. Ideal cure means the way he has defined it. He has defined very clearly in the second aphorism what should be the highest ideal of cure. That is the highest ideal, but at least certain points out of them should be achieved, and person should come again to the state of health, and it should be on the basis of cardinal principles of homeopathy. So that is what is a cure. So exactly what is a recovery and what is cure, that you have to differentiate. Cure is bringing back to the state of health is a cure. Just palliating the symptoms is the recovery. On 126 page, he starts, a cure is always result of an art and is never brought about by the nature. Very important thing which he mentioned in the bold. What he says? Cure is always the result of art and is never brought about nature. Nature itself never brings about cure. Nature removes the symptoms. Nature palliates the thing. If the disease is chronic, nature tries to put it on skin and palliates the internal turmoil. It never recovers. It never brings back again the state of health unless and until it is treated with the proper simillimum. And that's why a role of intelligence comes. That's why a role of art comes. That's why the role of science comes. Nature, however, aided or unaided, often brings about recovery under the operation of natural laws. Fortunate indeed is that for humanity that this is true. And this is more important, he is explaining. Nature tries to throw the things on the superficial part in order to save the vital organ. Many times it happens that patient has suffered internally, but to save the vital organs, nature tries to throw it on skin, whether the disease is psoric origin, whether a disease is psychotic origin, or whether a disease is of syphilitic origin. You just observe. It is thrown on the skin in the form of itch in case of psora. It is thrown on the skin in the form of primary chancre in the syphilis, and it is thrown on the skin in the form of pigworts or gonorrhea. Again, on the skin. See, manifest these are the external expressions of the disease in order to save the vital organ, but it doesn't mean the patient has cured. It is just a recovery in order to save the vital organ. So nature never brings about the cure. Aside from homeopathy, sanitation and surgery, the only real progress in handling the problem of the disease during last century has been in the adoption of hygienic methods of treatment tending towards natural recovery. The abolition of all drugs and dependence upon rest, diet, regimen, and good nursing, known as the expectant method. What Close was saying? He was saying that in the modern science, prescribing a medicine, they found the uselessness of it many times, and that's why they stopped prescribing. They starting concentrating on the causes of diseases. They tried to find it out, the proper methods of sanitation in order to prevent the disorder or prevent the communication of the diseases. Then the maintenance of the health by personal hygiene. All those methods were developed. But those methods were not curative methods. Those were the preventive measures. So it was not possible to get ideal cure with the help of those methods. So giving a proper diet, maintaining the rest, maintaining the proper daily regimen, good nursing, yes, definitely it shows the recovery, it shows the better feeling for the patient, but it is not the thing which cures the patient. This is the most important thing which he is trying to impose on your mind. Being an homeopath, you must develop an art to cure the patient. For example, if the patient is there in front of you suffering from the cancer, you give him a rest, you give him a proper diet, you explain him proper regimen. But this is not sufficient to cure the patient. If you want to cure, you will require a proper medicine. You have to find it out what is wrong with the patient. You have to utilize the intelligence. You have to utilize your art. Today, there is one patient suffering from cancer, mouth, with metastasis. It was started on left side, then it has turned to the right side. And he was operated twice. He has given the chemo, he has given the radiation, and patient was in a worse state 1 year back. And the whole history was very typical. It has started from suppressed skin eruption, suppressed eczema, and then the disease was developed. But it has started by starting the pain on left side of the teeth, and he went to the dentist. He has taken the X-ray. He found there is some infection in the lower side. Then he said that you have to remove this teeth, and he has removed the teeth. And just after removal of the teeth, there was a swelling, and then they took the biopsy, and then it was considered to be cancer later after 2-3 months. I have given him a symphytum, a remedy which is mentioned for cancer in the mouth after teeth extraction. Patient was in a worse state, whether he will survive for 15 days or 20 days, that was the condition at that time. Patient, now it is nearly about 1 year to happen. Next month, it will be a year, and patient is still normal. Patient is, at that time, he was not able to swallow the fluids. He was used to swallow only fluids, nothing else. Now he used to eat. There is a weight gain. The whole swelling disappeared on the face. Yes, there is growth still persist on right side. It has started on left. We operated over there, shifted to the right. Now there is growth, but he is able to take the intake. He is able to move. He walks nearly 45 minutes per day, and he has maintained his health. This is what is needed. If you would have asked him only to maintain diet and everything, it would have not cured. That is the difference between cure and recovery. The rate of mortality in certain diseases has fallen in proportion to the degree that meddlesome medication has been superseded by sound hygienic methods. Previously, mortality rate was much more. Yes, preventive and social medicine had made the difference, definitely. But what has happened with preventive and social medicine? The cure rate is not increased, recovery rate is increased. See the difference. This is what he wants to highlight. Yes, with preventive and social medicine, the mortality rate has reduced. But patient is not coming to the normal state of health, but he is actually, from dying, he is saved. So this is what happens with the modern medication and the methods which are followed, like hygienic methods, then the rest, then the diet, then the regimen, and good nursing. The definition of recovery. Recovery is a spontaneous return of the patient to the health after the removal disappearance or cessation of exciting causes, and occasion of disease, or as a result of treatment which is not directly and specifically curative in its nature. Very specific definition he has made. Very specific. Either you give medication, either you don't give the medication. It is a spontaneous returns to the state of health after removal or disappearance of the cessation of exciting causes and occasion of disease as a result of treatment which is not directly or specifically curative in its nature. Recovery takes place by virtue of existence of sufficient integrity of the organ and inherent power of reaction in the patient to overcome the disease producing agency without the aid of homeopathic or healing. Recovery is favored by the application of sound principles of mental and physical hygiene, judicious mechanical or surgical treatment when required, avoidance of drugs used for their physiological, really pathogenic effects, and by enlightened sanitation. So, recovery is possible with all those methods, and those are improved in modern medicine a lot. If you would go to the history 200, even 60, 70 years back, you will find that such methods were not there. Now modern medicine is coming with all those methods, poor, good sanitation, good personal hygiene, proper food, proper dietary timetable, proper dietary regimen, daily regimen, all those things are improved. And because of which there is a good recovery in the patient's state of health, but not complete cure, not bringing back again the original state. And this is what is the recovery. He wants to explain to you that you must achieve not only the recovery but also an cure. With the help of homeopathy, you have to go beyond the recovery. The expectant treatment inadequate, nature unaided, however, or with the all aid afforded by the expectant treatment by sanitation and surgery is unable to cope successfully with many forms of severe disease. Such diseases as cholera, yellow fever, pneumonia, diphtheria, typhus, and typhoid fever, smallpox, and many other diseases take a heavy toll in mortality, practically uninfluenced by the expectant treatment, except as compared with the much lower, greater mortality under the ordinary drug treatment. If diseases are divided into three classes, with regard to their rate of mortality, the highest mortality is found among the treated by ordinary drug methods, the next lower under the expectant method, and lowest under the homeopathic treatment. He is comparing with the disorders and their cure rate. If you give just a ordinary method, that is the if with the symptomatic treatment, the mortality rate was very high. It was when Close has written, it was very high. Now it has changed. Now mortality rate has came down because of the all the methods, giving importance to diet, giving importance to the regimen, giving importance to the personal hygiene, giving importance to the sanitation methods, all those things because of which mortality rate has much reduced. But if you treat along with that with homeopathic treatment, it has absolutely reduced a lot the superiority of homeopathy. Now he turns toward the what is achieved with the homeopathy. Homeopathy has gained its greatest triumphs in those diseases which are uninfluenced by even the expectant treatment. Of these, cholera is notable example. With the normal mortality of from 40 to 70% under any form of treatment, the mortality under the homeopathic treatment, but otherwise under precisely the same general condition, has been as low as 4%. These were the details during Hahnemannian time. Hahnemann was the first one who has explained that cholera is caused because of something invisible creatures not visible to the human naked eye, and they transmit from one person to another person through the utensils where they develop or increases in quantities. He has he has explained that on shipboards, in the confined places where these creatures increases, all things without microscope, he has explained, and he has explained that how to reduce the mortality. He has explained he has written the book on cholera during his time. And he explained that you must treat in such a way. You isolate the patient, you should not use the utensil used by that fellow, then give him plenty of water. Then he has mentioned about all those things. And along with that, give the homeopathic remedy. The mortality rate, which was 40 to 70% under the ordinary treatment for cholera at that time, and people were dying because of cholera. With the homeopathy, the rate was only 4%. This was the big difference. So it was just start of homeopathy at that time. Still, there was so much of difference. That is the superiority of homeopathy. Substantially, the same is true of other diseases, in all of which the mortality is distinctly lower under the homeopathic treatment than under the expectant treatment, which is itself so superior to the ordinary drug treatment that the leaders of thought and research in the regular school warmly advocate the abandonment of all drugs except mercury, quinine, morphine, and in special cases. So, after using those homeopathic medicines, it was known to the people that the ratio has changed. Homeopathy was coming strongly to tackle all those communicable diseases with proper application of the principles and getting the ideal cure over there. So that was big thing, and that was big change. It has been said that all other diseases except the malaria, except the where there is a danger, other diseases, if you don't give medicine, there is at least recovery. And with homeopathic medicine, there is a cure. It is the duty of every physician to avail himself of all the resources of hygiene, sanitation, and surgery. But it is also a duty to put prejudice aside and investigate the claims of the methods of medication, which can show such markedly superior results as does homeopathy. There was a lot of change happened in the people's mind. That there were methods which were followed since long time, but still the peoples are not accepting the superiority of homeopathy in treatment of such disorder. They goes with the common methods. Immediately the investigation is done. The fever is there, and on day one, immediately the investigations are done. Even though it has been told in the books that first 3 days, if you investigate, you don't get anything. At least 3 days, you should wait for it, but no one is doing that. No one is following, no one is giving chance to recovery. No one is waiting for that. And no one is understanding that without producing any harm with all those medicines, it is better to give the homeopathic medicine, which produces an ideal cure without causing any harm to the patient. But it was not getting accepted. Homeopathy alone, of all therapeutic methods, can legitimately claim to effect true cures by medication, as distinguished from recovery. And this it claims first, because it is based upon a definite general principle or law of nature. Second, because it is able to successfully apply the principle to the individual cases. And third, because it does actually restore the sick to health quickly, safely, gently, and permanently upon easily comprehensible principle. And he explains why there is superiority of homeopathy. Basically, there is superiority of the homeopathy. It is only because it is based on specific fundamental principle. The medicines which we used to use are based upon law of cure. Second, it was because you homeopathy treats individually. There is no group treatment. And third important thing which is mentioned over there, it used to produce a permanent cure with the help of based upon easily comprehensible principle. There is no speculation. in homeopathy. Whatever is there is very simple. Yes, this is the state of the patient. Find it out remedy, antitype totality in the remedy, and give that remedy in proper doses. This is what is homeopathy. And this he explains over here and tries to explain the discrimination between cure and recovery. So I think we'll stop over here. Tomorrow we'll going to learn the further few concepts which he tried to explain over there. So it is a chapter which guides you to understand exactly what Hahnemann expects from you. Hahnemann expects cure from you and not only just a recovery. And how this should be, that he mentions in this chapter. So Stuart Close philosophy looks little bit difficult to understand, or sentences difficult to understand. But my suggestion to all of you is that read that little bit time you spend over there, understand it, then it helps in your practice a lot. So that's all for today. We'll meet at 8 o'clock with the new medicine, that is ammonium muriaticum, in today's session. So be there. We'll meet again at 8 o'clock. Thanks and good evening.